All right. Good evening, guys. Test one review. Okay, mainly 1 and 3, maybe one question from chapter 2, but not much. So, some of the key things that we need to know is what is pathophysiology, the definition. Okay, environmental factors. What are some environmental factors for diseases? And if it's genetic and environmental, what is that called? Communicable, multifactorial, or unpreventable? All right. Clinical manifestations. So be able to recognize some of the clinical manifestations of certain diseases. All right. So when we say clinical manifestations, what is the definition? So for a heart, respiratory, GI, what are some of the clinical manifestations we expect to see? What a disease process? Asymptomatic disease, how do we detect that? Okay, inflammation, what is the role of exudate? What are some factors for inflammation? What happens with poor perfusion and inflammation? Acute sinusitis. Okay, what is that? What are our clinical manifestations? And when we talk about acute and chronic, how many days or weeks is acute? And then what is chronic? So remember, your acute is going to be less than 6 months, chronic's over 6 months. So generally, when we talk about an acute phase of a disease, it's somewhere between those 4 to 8 weeks. That's considered acute. All right, rheumatoid arthritis. Um, what is it characteristic? What are some characters? What is it characterized by? All right. And what is it not? What do we not expect to see? Pancreatitis. What are some causes of acute and chronic pancreatitis? When we're talking about celiac, what is the what is celiac and what do they have to cut out of their diet? All right. What is septicemia? What can that be a complication of, or what can occur with septicemia? Osteoarthritis and rheumatoid arthritis. What's the difference between the two? Lyme disease. How does Lyme disease occur? And what are some characteristics or manifestation of our Lyme disease and our lupus? If somebody has a high white blood cell or a 90% neutrophils, 2% eosinophils, and 1% basophils, is that an indication of a bacteria with elevated white blood cells? Wound care. What are some factors for wounds? Healing. What do we need in our diet? Burns. What are our stages of burns? Okay. And for lupus, our different I lost my brain. For lupus or taking care of patients, who would be a priority? So what would make somebody more of a priority than somebody else? Signs of lupus? ESR, the sedimentation rate, and then your leukopenia and thrombocytopenia. Okay, what are those two indicators of? Okay, a high neutrophil count will indicate what? Okay, HIV and AIDS, what is our manifestations for that and what's the purpose of the therapy? Chronic sinusitis. If somebody has a polyp, what do you think would occur more often if somebody had nose polyps? Would they have more headaches, sore throats? What would you think if you had a polyp in the nose? Okay. Again, your clinical manifestations of certain diseases that we discussed. Pancreatitis, acute and chronic. Allergies. Okay, what's an anaphylaxis? Okay, bee stings. What do you give if you have an anaphylaxis? Anaphylaxis, what is the medication we're going to give first for that severe allergy? What is the body always trying to maintain? Your risk factors that are modifiable for chronic diseases. Crohn's disease and ulcerative colitis, what's the difference? What is the major goal of the inflammatory response? What's a pandemic, an epidemic? Etiology. Your first, second, and third tertiary. First, second, and third level of care. Prevention. So primary prevention, secondary prevention, tertiary prevention, recognizing those, all three. H. pylori, what do we do for H. pylori? Okay, it's chronic gastritis, and what are we gonna provide? What's an antibody? Okay, and what is the antibody that is present in breast milk? And which one crosses the placenta? All right, so that is some general material that we have talked. What is the focus of epidemiology? All right, a couple of key terms we talked about already: pathophysiology, morbidity and mortality, exacerbations, asymptomatic. Okay, the cells. And so remember we talked about that table for inflammation. Table, where is it? 4 points. Granulation tissue. What is granulation tissue and keloids? and the body's first line, the body's defense mechanisms. All right, that should help get you started with some guidelines of what is on the test. All right, if you have any questions, let me know tomorrow. I'll be available.